joining me now is Dr. Michael McDermott. Now, he is president and chief executive officer of Mary Washington Healthcare in the Fredericksburg area. That's where Bill Howe lives, supermajority Speaker of the House, and our good friend Bill Howe. Now, before becoming president and CEO, Dr. McDermott was a practicing radiologist. So you have these hospital executives that actually practice their trade, right? He was a radiologist. And right now, Dr. McDermott serves on the Virginia Hospitals and Healthcare's Association Board of Directors. So it was like big time. And he's also been named a top doctor by Northern Virginia Magazine 3 times. I don't know what that means, top doctor, but it sounds like a pretty prestigious type of a thing. Dr. McDermott, great to have you here.
Good morning, John. Thanks for having me today.
Okay, Dr. McDermott, we're really fired up to be at the the Virginia Hospital and Healthcare Association's annual meeting in Bath County, Hot Springs. McDermott, in your mind, coming here, driving the 3.5 hours or so from Fredericksburg over the mountains, what do you think should be and is going to be the focus of this conference?
Well, the conference theme is financing the future, successfully investing for tomorrow's healthcare. It's an important topic because of the challenges facing hospitals. For us, those challenges include declining government reimbursements from Medicare and Medicaid, which don't cover our costs for delivering care, a growing charity care burden. In 2013, Virginia hospitals provided over $627 million in free or discounted care to thousands of Virginians. That's a 57% increase since 2008. And federal government funding cuts that we face due to the Affordable Care Act and sequestration. The Affordable Care Act cuts to Virginia hospitals. They're projected to reach about $1 billion annually in about 6 years. And we've had the lack of offsetting state policy action to alleviate our costs resulting from government care mandates and regulatory pressures. As you know, John, hospitals are major employers and economic engines for the Commonwealth. Most hospitals in Virginia are not-for-profit. That includes Mary Washington. But our economic importance is significant to our communities. Many Virginia hospitals are the largest employers in their community.
Well, that's, Dr. McDermott, that's one thing that people don't realize is that, you see about hospitals and you think, well, if they don't have certain provisions for me to get care or whatever. But Dr. McDermott, the other thing is with hospitals, especially in more rural areas, they're the major provider of jobs. They're the economic engine. It's just beyond providing health care on the surface, if you will. Now, despite hospitals' importance and the obvious challenges they face every day, convincing our General Assembly in Virginia to do something has been, let's call it challenging, all right? And we've been on this thing for a very long time, Doctor. We're not in favor of Medicaid expansion. The other problem is that if that's the only argument, it's highly polarized. It's partisan. Nothing's going to happen. We had the incident where they almost shut the government down. We're not going to get that. But there's got to be another answer for that. And do you have some groups questioning how serious the financial challenges are, and can we start to change those perceptions in the State House?
Well, John, the evidence is clear. Nearly 60 rural hospitals have closed across America since 2010, and that's not a coincidence. Several hundred more are endangered. One hospital in Southwest Virginia is already closed. But it's not just a rural issue. The financial strain placed on hospitals is also felt in urban and suburban communities. Across the Commonwealth in 2013, about one-third of our state's acute care hospitals had negative operating margins. Among rural providers, it was about half. That fact is based on state data. It's been confirmed by independent fact checkers. I know there are those who attempt to dispute that, but the numbers don't lie. And meanwhile, some critics say the state's Medicaid program is too inefficient. And that's why many members of the General Assembly oppose efforts to enable more people in our state to obtain health insurance. We heard that argument again this week when a state agency released a Medicaid assessment, but that assessment concluded that at most there was less than 0.5% of spending that might have been misapplied. And relatively speaking, that's minuscule. That should not be significant justification to dismiss dialogue about the need for health policy solutions in Virginia. You know, at this point, 30 states and the District of Columbia have expanded Medicaid. Republican states, Democratic states, several states have found innovative ways to mold the program to fit their specific needs. You know, I know we have talented legislators in Virginia who are capable of developing creative policy solutions.
Talk about outreach and public awareness. I know that hospitals are really working hard on that, but what are the messages that you think you'd be able to bring forward that just might make a difference?
Well, John, you know, Virginia hospitals are our lifeline. That's our campaign thing. For the health of our loved ones, for the good of quality Virginia jobs and our overall economy, hospitals are vitally important. Economically, hospitals are a hub of activity in our communities. So statewide, hospitals and health systems accounted for $36 billion in economic activity in 2013. You know, that's a figure that's equivalent to about 86% of the entire state budget in that year. On the community care side, Virginia's hospitals and health systems are open and available for care for people across our Commonwealth at a moment's notice, 24 hours a day, 7 days a week. Hospitals provided over 3 million emergency department visits. We've delivered over 100,000 babies in 2013. You know, none of us expects to go to the hospital, but we assume that our local hospital will be there for us in our moments of need, and that's our mission. But, you know, government mandates, federal funding cuts, a lack of state policy solutions, they seriously complicate things for healthcare providers. You know, our message to state leaders is that focusing on healthcare policy compromise shouldn't be a partisan issue. It's a healthcare issue. Elected leaders on both sides of the aisle are focused on promoting job growth and economic prosperity for our state, and we share that vision. And we know that having a stable healthcare network is critical to our thriving economy and to public health. You know, to learn more about what's at stake, I encourage your listeners to visit our website, isupportvirginiahospitals.com.
You got to go there now. You know, Dr. McDermott, I think you hit the nail on the head. I've been saying for months that we have to solve this problem. It's a jobs and an economy issue, and I'm all about jobs for people, good jobs for American workers. Now, I'm a fiscal conservative, as you know, and I don't like Obamacare, but you know, Republicans like to say that the states are the laboratories of innovation, right? And Republican governors right now control 32 of the 50 states. Virginia certainly embodies that as one of, well, the original colonies of America, the mother of multiple presidents, and the state envied for its effective government, business climate, and overall quality of life. And if you get, I know sometimes you're driving around Northern Virginia and like, quality of life, what? Like, can't get off a highway. Or if you're like me in Virginia Beach, you try to get a quart of milk, you have to go through a tunnel. Okay, I get that. But when you're in beautiful Bath County and Hot Springs like we are, you kind of get the quality of life thing, right? But look, we don't want those things to slip away. And I know that having a strong healthcare system, look, it's critical to maintaining our status in Virginia. That's why I've called every day on Republicans and Democrats in the General Assembly going into this 2016 General Assembly to find a Virginia way solution on health care policy. Dr. McDermott, again, remind our listeners where they can learn more information about the challenges facing Virginia hospitals.
I'm happy to do that, John. The website is isupportvirginiahospitals.com. Again, that's isupportvirginiahospitals.com.